Okay, today we will be demonstrating the maxillary bisecting technique. I'd like you to refer to and use in clinic the two most important handouts that we gave you. One is a schematic of a bisecting full mouth series. The other is a schematic of the angulations required for taking specific shots in the bisecting technique, both maxillary and mandibular. So for purposes for today, I will be showing you placement for the anterior bisecting shots and only the right side for the premolar and molar bisecting technique. As we know, in a quick review, for bisecting we use size 2 film. And the two film holders or instruments that we do use for bisecting technique are the snap array, which is primarily used for the premolar and molar shots, but we can also use it in the anterior, and I will demonstrate that technique. And as well, discussed in lecture is the stave bite block, which is used for anterior exposures. So I'll begin without further delay. I'll start with the stave bite block because the radiographs that I would be demonstrating in the anterior would be the central and lateral incisors, and for our purpose today I would do the right canine. Then I would do the premolar shot and the molar shot on the right side. The technique is the same for the left side, so in order to not be redundant, I will continue just with the right side. So the placement of the film, size 2 film, always make sure the white side is your exposure side. I feel for the embossed dot on the film, place it in the stave bite block. And my first shot, coming from the anterior, would be the maxillary anterior teeth. The central incisors, both 2, 1, 1, 1, and the lateral incisors, both 2, 2, and 1, 2. Now, my first concern is to ensure that when I place the film is not bent in any way. Our client or our Dexter today has a very shallow palate. But by not bending the film, we decrease the likelihood of distortion in our exposure or our final radiograph. Now, what I will do is I get my X-ray tube head with the PID ready, and I look at my X-ray machine to see what the exposure should be. In this case, I will place it on the incisor exposure that would be both for maxillary and mandibular incisors. By placement, again, what I like to do is I think about my point of entry, again outlined on your sheet, and my point of entry is through the tip of the nose. The angulation, in most cases, should be plus 40 degrees. In our case today, as I said, there's a shallow palate. And one of the things that we worry about with a shallow palate is if our vertical angulation is too low, then that increases our chance of elongation. So I will adjust it accordingly. I'll make sure, when I look at my placement, I'll make sure my PID covers the film completely. Check my angulation. And in this case, it is a little bit higher. It's at about 43 degrees. And I check it here on the arm. Placement is set. My PID is parallel to the film and my vertical angulation is about 42 degrees. I'll go and take the exposure. Now, I'm going to continue to use the stave bite block, and I will do the canine exposure. I'll do a quick review of the anterior exposures with the snap array as well. So I look for my canine. My key here is to center the canine in the middle of the film. The film may angulate slightly. It is a size 2 film. Again, my main goal is to make sure the film is straight, flat, not bent or curved. My next point of entry for the canine shot is the ala of the nose. Lining up my angulation, again, I think about my PID covering the entire film to ensure I don't have any cone cuts. I look at the exposure. I see that the PID is primarily parallel to the bisector. With a real client, I would definitely ensure I would not touch the facial features of the nose or any part of the face in any way. However, with Dexter, it's a little more forgiving, but it's better not to get in the habit. Now my angulation in this case for the canine shot, maxillary canine shot, is 45 degrees. I'm looking at the film. Remember, the palate is shallow. The film is more flattened when placed. I look at my angulation indicator on the tube head arm, and it's now closer to 50 degrees to compensate for the shallow palate and the flattening of the film. I take my exposure. So remaining on the right side, obviously I would use the same technique and probably the same angulation for the left side canine. Now with the snap array, the film placement for the anterior, this is the bite tab. Again, remember, dot in the slot, because the dot, when mounting the film, should be placed or should be present at the incisal or occlusal edges. So for a quick anterior display, here's the bite tab. Now, the snap array is a wonderful instrument. However, with the anterior shot, the one thing that we have to do in order to stabilize the film is often use a finger. If we were using, in our case, here's our dexter finger with a nice little right round knob, but it will hold the film in place for the exposure. I can push the film a bit further up, but make sure that I get the incisal edge. What are my dislikes? My first dislike is with the snap array is that the film can bend easily, which will distort the picture. Also, it's the extra exposure by using the finger to stabilize the bite block or the snap array instrument. What also can happen is when held, it can be moved by the client inadvertently. Now, I'm looking at the film. It's not bent, it's flat, but it's much more flat than when I use the snap array because of the shallow palate. So going through the tip of the nose, I may have to increase the vertical angulation ever slightly so much in order to decrease elongation. So in this case, we see that it's plus 40 degrees, as I mentioned before, but when using the snap array, I'm increasing the vertical angulation to almost 50. Now I'll go around and do my canine shot. Same principle, center the canine at the middle of the film, bite down. Use your finger in this case, and let's hope our finger cooperates. Sometimes they don't, but here we go. Wonderful. And this time again, I go through the ala. The film is not bent or distorted, which will decrease the distortion, I should say. But again, it's more flat, which means I have to increase my vertical angulation even more. According to our chart, it should be 45 degrees on my PID, on my tube head. I'm almost up to 54 degrees for the canine shot. So that's just a quick synopsis of the anterior shots. Now I'll do the premolar shot. And for the premolar molar shots, we only use the snap array instrument. So again, what we'll talk about, always remember that the larger portion of the snap array is where that goes towards the buccal surface, simply because that's where the bite or where the occlusion should occur and where the bite should be. Next thing to always remember is dot in the slot. Again, to ensure that the occlusal edge the dot is at the occlusal edge. Make sure the film is flush with the bite tab. And again, remember your white side is your exposure side. Now for the premolar shot, we always remember our landmark, and in this case again, our landmark is the distal of the canine. What I will do with the film is move it slightly to the mesial to ensure that the seam is more towards the mesial to ensure that the distal of the canine is in the shot, because the seam does not have the actual film in that area. In this case, again, my worry is to the film or any bending of the film, so I try to flatten the film as much as possible, keeping my landmark in place. So what I often do is, if there is any difficulty, if the palate is shallow or the floor of the mouth is shallow, I will put in a cotton roll or two to secure the bite tab, but at the same time ensure that the film is flat and as flush against the teeth as possible. As we know with the bisecting technique, it's very important to try to get the film as close to the teeth as possible. Even if it doesn't always work, it's probably our best way to determine the angulation. Sometimes because of anatomy, for example, tori, palatal tori, mandibular tori, we may have to move the film slightly away from the teeth. However, that's sort of our principle, and then we work with our angulations considering that type of anatomy as well. So in this case, I've placed my film straight, no bending, in the shallow palette, slightly tilting the bite tab. And again, what will happen is I may have to increase the vertical angulation slightly. So in this case, I'm going to look at the premolar shot. And again, as I said, it's important to use that as your index in the beginning. It says about 30 degrees. What I'll look at is I'll place, first of all, I want to make sure that my PID is horizontal to the film as possible to decrease the chances of overlap. Remember that my point of entry is mostly through the pupil or the inner canthus of the eye. I'm lining up my PID. Again, I'm a little close to the eye there, but I'll keep it away a bit more. And remember that when you have real clients. And because, again, the shallow palette and the film placement itself, I've increased the vertical angulation to approximately 37 degrees on this particular shot. Before I take my shot, I want to make sure I have the right setting. In this case, second setting is the premolar setting. Now our next shot and our final shot would be the molar shot. In our molar shot, I won't change the film. I'll use the same film. We haven't exposed it, but just for demonstration purposes. And I'll go back slightly, use my landmark, which is the distal of the second premolar. In this case, our second premolar would be the 1-5. I place my film. Again, I'm cognizant of the fact that I want the film as close to the teeth on the lingual as possible. I'm looking at my film and I see that it's nice and straight. It's not bent or in any way contorted to reduce the quality of the image. I see that I've brought my film slightly to the mesial of the second premolar, but that will ensure that I will get the distal of premolar because the seam will be taken into consideration. So I set up the shot. Remember, my point of entry is the outer canthus of the eye. So basically the angle of your eye. I'm lining up my PID so that I see that it's as parallel to the tooth as possible, or the film as parallel to the PID as possible. And really we're looking at a full parallel plane from PID to tooth to film. Then I'll again refer to my notes, which tell me the angulation for the maxillary molars should be about 15 degrees. That would be the same for the left side. But again, we know our Dexter here has a shallow palate, so I'm looking at increasing the vertical angulation. Let's say his palate was vaulted and higher up. Then what I'd like to do is the film would actually be probably straighter, and what we'd have to do, because it is flatter against the teeth, will be straighter out. We would have to decrease instead of increase the vertical angulation. So again, we know it should actually be, sorry, I read it, oh, it should actually be at 20, plus 20 degrees, so that's a mistake. It should be at plus 20. I was reading the other line down. So it should be at plus 20. But in this case, we know what's going to happen. We have to increase the vertical angulation because of the shallow palate. So when I look at my angulation here, it's at about 25 degrees for the maxillary molar shot. Line it up, make sure that the film is covered by the PID. Make sure that my PID is flush with the base of the snap array bite tab. It's aligned with the film. As I said, the angulation is about 25 degrees. And then what do? I have to make sure that I change my setting. And I go all the way to the last setting, which would be the maxillary molar setting, and take my shot. So in conclusion, that would be the maxillary bisecting technique. Obviously, as I mentioned before, we would also do the left side. We would include 7 size 2 films for the maxillary shots or film. And basically, we have to always be cognizant of the anatomy with respect to the angulation. Although we do have a template, it's very important to look at the anatomy, think about it, but 3 key points we should always keep in mind. Keep the film as straight as possible. Align the PID as parallel to the imaginary bisector as possible. And try not to bend or distort the film in any way when placing, otherwise the resultant image can be distorted and it will compromise the quality of your radiograph. And that's it for now.